Hello, welcome to my subscriber and new viewer. I hope you are all well. Today I am going to explain with you about the US healthcare system. So let's start. The healthcare system in the USA, an overview of the American healthcare system. Healthcare facilities in the United States are largely privately owned. Health insurance in the USA is primarily obtained through employers independently, through private purchase, or through government-based programs. Some low-cost and cost-free healthcare services exist through non-profit organizations, charities, and publicly funded programs. However, internationally visitors should always carry insurance when they visit the United States. The cost of treating a serious emergency can be high. The cost of getting medical services in the US is the one of the highest worldwide, which makes sense to be insured when visiting the country. The United States is home to some of the best hospitals and research facilities in the world. The top treatment hospitals include the Mayo Clinic, the Cleveland Clinic, Johns Hopkins Hospital, Medical Center of UCLA. The United States also has the most highly ranked hospitals in the world for cancer care, cardiac care, and orthopedic medicine. There is a wide range of public and private hospitals, surgery centers, urgent care clinics, and especially clinics in major cities. In smaller communities, care options more limited and may include anything from a country hospital, a community care clinic run by nurse, to telehealth services. Pharmacies, vaccines, and medication in America. 35% of the pharmacies in the United States are independently owned small business. The remaining pharmacies are located within other facilities, including drugstores. Though the terms drugstore and pharmacy are used interchangeably, clinics, grocery stores, and hospitals. A significant number of these pharmacies are owned by chain brand stores such as Walgreens and CVS. A recent review shows that 37% of prescriptions in the US are filled by mail order. Common over-the-counter medication are also available in most retail environments, including grocery stores, gas stations. Unlike other countries, pharmacies in the United States are often large one-stop shop centers. The major chain drugstores have their own in-house brands of over-the-counter medications, which you may see on the shelf next to expensive brand names. If you are shopping for common complaint allergy medications, ask the pharmacy team if they have a less expensive generic equivalent. Note that most drugstore staff are not trained in pharmacology. If you have a medical question, you have to ask the pharmacist or other assistant, not just the store employee. So if you are bringing medications to the United States, whether it is prescription or over-the-counter, they should be in their original labeled container. The US Food and Drug Administration (FDA) recommends that you bring no more than 90 days supply of any medication to the US and that you bring a doctor's note in English explaining why you need the medication. There are no mandatory vaccinations to travel the United States as a visitor as of when this article was published. However, in August 2021, the United States government announced an intention to require all visitors to be vaccinated for COVID-19 when entry restrictions are lifted. While the USA presently does not mandate vaccinations, foreign governments and the WHO recommend visitors to the USA be vaccinated against diseases including hepatitis A, B, human measles, mumps, rubella, polio, etc. If you are immigrating to the US seeking permanent residency, the following vaccines are mandatory. As with all destinations, speak with your doctor before you go to make sure your routine immunizations are up to date. US health and travel insurance plans for international comprehensive international medical insurance in the USA. There are short-term up to 1 year travel insurance for visitors to the USA, introduction to healthcare system in America. International and International Students Insurance.com have created an informative 6-minute video providing an overview of the US healthcare system. It addresses the challenges of navigating the healthcare system and some tips for taking care of yourselves. While it was designed for students, the information contained in the article is relevant to any visitors or immersed to the US. The video provides advice and tips for preparing to come to the US, examples of cost for a specific medical treatment in the US, finding a provider, and an overview of terms. Their site offers more information, especially for students, at the overview of US healthcare for students. Insurance recommendations to consider before going to the USA. Remember that there is no universal healthcare in the USA. While the US pays for healthcare for specific groups such as the elderly and veterans through programs such as Medicare and the Veterans Health Administration, overall the government does not sponsor health benefits for its citizens, such as foreigners. If you need medical care, you pay for it in full unless your insurance policy covers it. Additionally, getting health insurance in the USA provides you with the advantage of choosing your primary care provider. You can select the clinic, hospital, nurse, or physician that will attend to your needs whenever you need a lab test, care for an ongoing condition, or a quick response during emergency, so long as that provider is included in your insurer's network. Knowing the hospital and doctor that will take care of you adds confidence and assurance that you are in safe and capable hands. Choosing the right health insurance in the USA is very important for us in shortlisting health insurance for foreigners in the USA. You have to consider several factors to make sure you optimize its benefits without sacrificing coverage. While staying with budget as a guide, consider the following questions to help you decide the kind of insurance you need before traveling to America. How old are you? Do you have any underlying health conditions? Does your family have a history of illness that might manifest in the future? What are your plans for traveling to the USA? Do you intend to take a vacation there for a few weeks, or do you plan to stay there for several weeks for work? How much you can pay? Allocate for medical needs and monthly insurance payments. Will you still have extra money left to pay for expenses after you have paid for your insurance coverage? If you are non-resident seeking health insurance for foreigner in the USA, you want a plan that fits your budget and medical needs. If you are unsure of which plan to get, we are here to assist you to help and find plans from the most trusted insurance providers worldwide. We can also provide with you free questions so you can better assess your budget and wisely choose health insurance in the USA that will fit your situation. So that are the US healthcare system. I hope you all are understand about the healthcare system in the USA. That's all for today. Thank you very much.